need no debating. If you want the facts and the real information, never hiding, keep it honest, unbiased. This is what you want. This is under the COVID dome. Hey, yeah, everybody talking like they're experts with different agendas. We here to put the facts first. Every episode talking different issues about COVID that we know many never knew. From FDA approval versus authority, from remdesivir to Anthony Fauci. Hey, under the COVID dome, let's get it moving. You don't wanna miss a thing, you just gotta tune in. Yeah, this is under the COVID dome. Yeah, this is under the COVID dome. You want the truth and you want the facts. We gon' bring it to you. Tell me, can you handle that? Hey, yeah, this is under the COVID dome. Yeah, this is under the COVID dome. You want the truth and you want the facts. We gon' bring it to you. Tell me, can you handle that? Yeah, it don't matter what they say or how they feeling.
Under the COVID Dome, Episode 2. Thank you for bearing with me. I know this episode is coming out weeks, actually a month later than what I said. In my first episode, I had promised to put out an episode every other week, and I feel that I am back on track with that. I will be. But this topic for this episode is all about Moderna, and I cannot tell you how many rabbit holes I went down with this company. Oh my gosh. And let me just say I've researched everything that I'm going to put in front of you, but it is my opinions are interspersed within the information, and whatever your takeaway is yours. I feel like they're dirty. They should not be in business, and they are so far tangled up with the government. That's why they're getting away with what they're doing. But enough of that. We're going to dig all through that information. I can tell you that I have 70 pages of notes. I just had to stop. I just had to say, you know what? If I continue finding stuff on this company, I'm never going to get this podcast started, and this is actually going to end up being a book. So I just ended it where I ended it, and later on we can go back and revisit more information that I had came up with. But thank you very much for listening. I appreciate you all. In case I didn't tell you, my name is Laura Harvey. This is only my second episode, so please be kind. And this episode is Moderna. I anticipate this is going to be probably at the very least 2 parts, possibly 3 parts. And again, I do want to apologize for not posting it when I said, but moving forward, I feel like we're in a good place. So I just want to begin by saying how I got started on this episode for Moderna. I was looking around trying to figure out where I wanted to go next after doing the first episode, which was explaining the difference of an EUA, emergency use authorization, versus full FDA approval. Significant difference. I know I just want to revisit that for a second. People that I had came across through social media believed when they got their vaccines that it was under full FDA approval, when number one, the only vaccine that is approved is Pfizer. The Pfizer biotech, Comirnaty, that was not approved till October of last year. Johnson & Johnson and Moderna are still under the EUA. And Pfizer's is under the EUA for children. It's only approved for adults 18 and over. So that's how that all came to be. So for Moderna, I had came across this article that was published by a website called Unlimited Hangout, and it was written by Whitney Webb. The title was Moderna, a company in need of a Hail Mary. And I found that very intriguing. And then I went on to read the byline. The byline said the following, quote, "Before COVID-19, Moderna was in danger of hemorrhaging investors as persistent safety concerns and other doubts about its mRNA delivery system threatened its entire product pipeline. Fear caused by the pandemic crisis made those concerns largely evaporate, even though there is no proof that they were ever resolved." So it was like the Oprah light bulb moment. Okay, this is going to be episode 2. We're going to talk about Moderna. That article mentions, and I agree, that COVID-19 led to some dramatic changes in how federal agencies manage the approval of medical countermeasures during a declared crisis, how trials for vaccine candidates are conducted, how the vaccine perceives vaccination, and even how the word vaccine is defined. So, I am not a pharmacist. I am not a biotechnologist. I don't make, manufacture, research the making of vaccines. I'm not in a laboratory. I have worked in an infusion pharmacy. I have worked in healthcare, but never in that capacity. So I just want to make that clear. I'm not a doctor. This is just information that's out there for everyone to dig out and find should you want to learn things or research things on your own. So I just want to start with some Moderna basics. The company was founded in 2010 in Cambridge, Maine, or Massachusetts. I'm sorry, Massachusetts. And the CEO is Stéphane Bancel. So I'm not sure. There's some French words that we're going to be going through. I am not French. And even though I did take 1 year of it back in high school when I was in 9th grade, I'm 60 years old. I graduated in 1979. I did not retain any of that class. I didn't even retain it for the class. I think I failed it. But nonetheless, his name is spelled Stephane. So I'm thinking that's Stéphane Bancel. So let's talk about him for a few minutes. And understanding him kind of helps you understand the atmosphere at Moderna. He served as Moderna's chief executive officer since October 2011, and as a member of Moderna's board of directors since March 2011. Before joining Moderna, Mr. Bancel served for 5 years as chief executive officer of the French diagnostics company, more French, bioMérieux. So I'm going to spell that in case I did not say it correctly. It's spelled bioMérieux. bioMérieux, S.A. Not sure what the S.A. is for. And he served there from July 2000 through March 2006. So he was there 6 years, roughly 6 years. He also served in various roles at Eli Lilly, including managing director of the Belgium market and as executive director of global manufacturing, strategy, and supply chain. So he was basically, he was in sales. He was in sales. I think he actually graduated from Harvard Business School with an MBA. So yeah, and that was in business management, I believe I read. So prior to Eli Lilly, he served as Asia Pacific Sales and Marketing Director for bioMérieux. He is a billionaire. So on Wikipedia, they have his net worth listed as $11.3 billion. Wikipedia also said he is a partner at Flagship Pioneering. Flagship Pioneering is when I looked into them, briefly. They're an American life sciences venture capital company. So I wasn't sure what a venture capital company is. It's a form of private equity financing that is provided by venture capital firms. They fund startups, early stage and emerging companies that have been deemed to have a high growth potential. Bansal also served on the boards of Indigo Agriculture, which is a Boston-based agricultural technology company, Boston's Museum of Science, and Qiagen. And I'm not sure I'm saying that because this is a German word, Qiagen, Qiagen, and that is a German provider of sample NSA technologies for molecular diagnostics, applied testing, academic, and pharmaceutical research. That's all one description for this company. And I'm going to repeat that because that's a lot. So, Qiagen is a German provider of sample NSA technologies for molecular diagnostics, applied testing, academic and pharmaceutical research. As of August 2021, his net worth was estimated at $12.5 billion in US dollars, and he owned approximately 9% of stake in Moderna, which is worth over $1 billion. So that's what I found on Wikipedia. But then, it's Wikipedia, so you want to try and confirm that. So I did find some other articles about his net worth. Forbes says that his worth is $8 billion, and Bloomberg says it's 7.57. Either way, it's a whole lot of moolah. It can buy 95.8 million barrels of crude oil or 4.17 million troy ounces of gold. So, and he's a young man. He's only 49 years old, and he has 2 children. I didn't want to dig too much into his family life. That's not the point of any of this. But it is, good to know his business background, and how he got into being the CEO of what has become one of the top manufacturers of vaccines in the world right now. So statnews.com, they did an investigation in 2016 into Moderna, which read pretty much like an expose. Some of the key points that I took away from that article was that it does have a caustic or toxic work environment that for years pushed away top talent. There is an obsession with security at that company, and it ran into roadblocks with its most ambitious projects. I mean, I was surprised to learn, and you may be surprised as well, that from 2010 until 2019 or 2020, nothing of Moderna's ever made it to market. It's never had anything get full FDA approval, which their vaccine right now does not have full FDA approval. It's covered under the EUA. So that was a very interesting and concerning takeaway for me, and we'll talk more about that. Bansal is very egotistical, according to nameless workers, and his need to assert control and impatience with setbacks that, are inevitable part of science, has hampered progress on a lot of his projects. Moderna, at the time of that article in 2016, was worth more than any other private biotech in the United States, and former employees said they felt that Bansal prized the company's increasing valuation more than over its science. Also, former employees have also said that failed experiments were met with reprimands and on-the-spot firings, which can be considered pretty toxic.